My name is Paige Hutton, and for my presentation for assignment 9, I have chose to do a presentation on chemical dependency counseling and what a chemical dependency counselor entails, what they do, what they make, and all of the above. So the career that I chose was chemical dependency counselor. Typical titles for this career are substance abuse counselor, intervention specialist, addiction counselor, and substance abuse plus behavioral disorder counselors, which I thought was an interesting title because addiction is also known by some as a behavioral disorder. The median or 50th percentile annual chemical dependency counselor salary is $50,324. The lowest, or the 10th percentile annual salary, is $38,223. And the highest, or the 90th percentile, is $61,036. Obviously, this depends on a variety of factors such as location, bonuses, and more. For hourly, the median, or the 50th percentile, is $24 per hour. Lowest, 10th percentile, is $18 per hour. And the 90th percentile is $29 per hour. And in Washington State, the income for chemical dependency counselors ranges from $47,092 to $54,485 annually. And that depends on what city you're in. In the Seattle area, obviously, it's the highest range. Eastern Washington ranges from $47,092 to $51,933, which is Yakima, where I live. So in Yakima, Washington, the median here, the main range for chemical dependency counselors, is $51,933. For training and education in this profession, the lowest level of education necessary to become a chemical dependency counselor is getting your associate degree in human services or a related field, or a 90 quarter or 60 semester college credits in courses from an approved school. At least 45 quarter or 30 semester credits must be in courses relating to the chemical dependency profession. The desired level of education for this profession is receiving a bachelor's degree in CDC or psychology and a master's in the specific form of counseling you're interested in. You must possess a bachelor's degree in chemical dependency counseling, and you must have at least 30 semester credits in the following. Actually, your bachelor's degree can be in chemical dependency counseling or psychology, something in the related field, and then you can go to get your certification. You must have at least 30 semester credits in the following classes: understanding addiction, pharmacological actions of alcohol and other drugs, substance abuse and addiction treatment methods, understanding addiction placement, continuing care and discharge criteria, including American Society of Addiction Medicine, ASAM, cultural diversity, including people with disabilities and its implication for treatment, chemical dependency clinical evaluation, screening and referral, chemical dependency treatment planning. You must pass either the National Association of Alcohol and Drug Abuse Counselors, which is NAADAC, or the International Certification Reciprocity Level 2 exam, ICRC. And you must accumulate 2,000 hours of supervised work experience, which could be at a facility like comprehensive mental health. You could do it at a school, shadowing a intervention specialist, which is who I actually interviewed for a paper that I did in my chemical dependency class this quarter. If you have a master's degree, it's lowered to 1,500 hours. So a bachelor's degree is the 2,000 hours of supervised work experience. If you have your master's, then it's 1,500. So obviously the higher level of education, the further you're going to go, the easier it'll be for you. The higher level of education you have in this field, the better chance you have to help more clients and to be rewarded personally and financially. Personally, I wouldn't want to go into this. This is what I want to go into, and I wouldn't want to go into this field because of the money. I don't think that that's ever a smart plan when pretty much anything in psychology, because you should be going into it for your passion for the subject and because you like to help people, because you're empathetic, those types of factors. As a substance abuse counselor, you'll be working with a variety of clients, typically with a lot of different needs. You may choose to specialize in certain issues which affect a specific population like teens or elder alcoholics or veterans. You will work with these clients discussing steps to cope with their disease and listen to their daily struggles pertaining to what causes them to engage in addictive behavior. Then you will start to incorporate methods to help your client gain clarity to start on the road to recovery. Each patient you have will be different, and they'll be dealing with different degrees of addiction. So you'll have to have the skills, the knowledge to be able to help each person with whatever they need. Some days you'll be working with patients in crisis, and others you'll meet with on a regular basis, helping them recover and fight to stay sober. As a chemical dependency counselor, you are the support system for your patients. So this career requires compassion and a lot of patience on your part. You will teach each client how to change small habits to result in the goal of recovery. Relapse is a common issue for addicts, unfortunately. So many clients you will be working with on a very regular basis to help them stay sober and to probably help them come back out of relapse, depending on if they want to be clean again and how they want to live their life. Other